Hi, this is Martin Gutenberger. I'll be going over how to search through a high-resolution chest CT today. So I have this case here which has both inspiratory and expiratory phases, which is our high-resolution CT. And when you look at the images, you can see they're pretty grainy. That's because they're reconstructed with lung filters, so that enhances edges but makes them look a little grainy. So we have inspiratory, expiratory, and then sagittal and coronal reconstructions in our scout images, and that's what our high-resolution CT protocol consists of. I guess start out looking at the scout image. You can get an idea of what you might be missing in the lower neck or upper abdomen. The other things you ought to see better on the CT, but it's good practice just for chest x-rays just to look at it, think about what you might say, but then move on and look at your CT. The next thing I will do is I will pull up two windows, both with my inspiration and expiration. Really your inspiratory images are going to be the main ones you're doing your work off of, and your expiratory images are essentially just to look for air trapping or to differentiate any sort of mosaic attenuation you might see between air trapping and differential perfusion. So the first thing I do is I try to get an idea of how well they took a breath in and took a breath out. So I look at the trachea. This trachea is nice and round, and the posterior wall here after he breathed out is collapsed in, so he did do a good inspiration and expiration. Then what I do next is I'll look through just the inspiratory images, and I'll follow my usual chest search pattern. I'll just go over it briefly here. If you want to know more, look more at the kind of routine chest CT search pattern. So I start by looking for lymph nodes. So I look in the axilla, look in the supraclavicular regions, and then look in the mediastinum. At that point, then I look at the heart and great vessels, and I look at the pleura and pericardium finally. This guy, you can see, does have a few mildly enlarged mediastinal lymph nodes, which is not uncommon in interstitial lung disease. We've got some measurements on a few of them. And after I've finished looking at the mediastinum, then I move on to the lungs. When I'm looking at the lungs, I guess I first start off just looking for any nodules, looking at the opacities. This guy has some reticular opacities throughout his lungs. I do my usual search pattern through the lungs, so I look in the anterior right lung and in the posterior right lung as I go through, just looking for nodules, masses. Also, because this is interstitial lung disease, CT, you're looking for things like bronchiectasis, honeycombing, air trapping, ground glass opacities, nodules, cysts, that sort of thing. So I go up and down on the right, and then down and then up again on the left. And then after I've finished my search pattern, I guess I try to make sense of everything I saw. So sometimes that takes more than just the scroll up and down like you might have looking for pulmonary nodules in otherwise normal lungs. So this patient, he has bronchiectasis. These airways are too large as you come out into the periphery. He has a few stacked cysts here in the periphery of the lungs. Honeycombing has been defined as 3 stacked cysts by some people, although that's kind of debatable, and I guess it's getting to be more of a pressing issue of whether or not there's honeycombing, because there are now medications to treat honeycombing, so you might be put on the spot to try to make a decision about whether something is honeycombing in UIP pattern. But that said, the definition can be a little bit variable, but this person definitely has some honeycombing, especially over here. And then he has his bronchiectasis, and he has some subpleural reticular opacities. Then going to his expiratory phase, basically if we saw any mosaic attenuation over here, then we would be looking to see whether it became more or less pronounced with expiration, and then if we didn't see any, we would also just be looking for any sort of air trapping. This person does have some heterogeneity. You're always going to have a little bit of air trapping. You have to decide whether or not you think it's abnormal. There are a few areas where he does have some air trapping, but it's not really the dominant feature here. This is just a person with UIP pattern interstitial lung disease. I will look at the sagittal images of the lungs just to get a sense of the distribution. This person, you can see mostly in the inferior portions of the lungs, the relative sparing of the upper lobes. You can also appreciate that he has volume loss within his lungs. Those findings also are in keeping with the UIP pattern. After I finish looking at the lungs, I will look at the upper abdomen. Again, just going through each organ, the liver, pancreas, spleen, kidneys, adrenal glands that I can see. Then I'll switch over to bones. This person's had surgery before, but I'll look through the vertebral bodies, shoulders on each side, and then go up and down through the ribs a few times, first on the right, and then on the left. And then I'll switch to the sagittal to look at the sagittal spine and sagittal ribs. And at that point, I am done looking at my high-resolution chest CT.